Have you ever wondered whether the changes you're noticing when you use the bathroom are simply a normal part of getting older, or whether your body is trying to tell you something important? Many men quietly accept waking up several times during the night, waiting longer for their urine to start flowing, or feeling like the bladder never completely empties. They convince themselves that every man eventually experiences these problems, so there is nothing they can do. The truth is far more encouraging. While aging does influence the prostate, many of the symptoms that interfere with daily life are also affected by the choices you make every single day. Small habits repeated consistently can help support prostate function, improve urinary comfort, and contribute to better overall health. I'm glad you've decided to spend these next few minutes with me because understanding your prostate isn't just about preventing disease. It's about protecting your independence, your confidence, your sleep, and your quality of life for many years to come. Think about how often prostate problems quietly shape everyday decisions. Some men avoid long road trips because they're worried they won't find a restroom in time. Others stop going to sporting events or movies because sitting through a couple of hours feels stressful instead of enjoyable. Many wake up repeatedly throughout the night only to spend the next day feeling exhausted, distracted, and less energetic than they used to. Over time, these small inconveniences begin to affect relationships, hobbies, work, and emotional well-being. What surprises many people is that these changes often happen so gradually that they barely notice how much their lifestyle has adapted around urinary symptoms. But here's the encouraging news. Your body has an incredible ability to respond positively when you provide it with the right support. While no lifestyle habit can guarantee complete protection against every prostate condition, research continues to show that regular physical activity, nutritious eating, quality sleep, healthy circulation, and proper hydration all play meaningful roles in maintaining prostate health as men grow older. These aren't expensive treatments. They aren't complicated medical procedures. Most of them cost little or nothing, yet they can make a noticeable difference when practiced consistently. One of the biggest misconceptions I hear from patients is that prostate health only matters after symptoms become severe. In reality, the best time to care for your prostate is long before problems begin interfering with your daily routine. Just as brushing your teeth helps prevent cavities, instead of waiting until pain develops, supporting your prostate early gives your body the best opportunity to stay healthy over time. Let's briefly talk about what the prostate actually does. The prostate is a small gland located just below the bladder and surrounding part of the urethra, the tube that carries urine out of the body. Its primary role is to produce fluid that nourishes and transports sperm. Although relatively small, its location means that even modest enlargement can begin pressing against the urinary passage. When that happens, men may notice slower urine flow, increased urgency, difficulty getting started, or the feeling that the bladder isn't completely empty after urinating. These symptoms become more common with age because the prostate naturally changes over time. One of the most common conditions affecting older men is benign prostatic hyperplasia, often called BPH. Despite the intimidating name, benign simply means it is not cancer. Instead, it refers to a non-cancerous enlargement of the prostate that becomes increasingly common as men grow older. Many men over 60 experience some degree of enlargement, although not everyone develops bothersome symptoms. This is why paying attention to your body matters. The earlier you recognize gradual changes, the sooner you can discuss them with your healthcare provider and explore practical strategies that may help. It's also important to remember that not every urinary symptom is caused by an enlarged prostate. Infections, certain medications, bladder conditions, diabetes, and even drinking habits can all influence how often you urinate and how strong your urinary stream feels. That is one reason why self-diagnosis is never the best approach. Persistent or worsening symptoms deserve professional evaluation. Many men delay seeking help because they feel embarrassed discussing urinary or sexual health. I want to reassure you that these conversations are among the most common discussions healthcare professionals have every day. There is no judgment, your questions are valid, your concerns are important, and in many cases, effective solutions are available. The goal isn't simply to help you urinate more comfortably, the goal is to help you continue enjoying the activities that make life meaningful. Whether that's traveling with your family, spending time outdoors, exercising, sleeping through the night, or simply feeling confident enough to leave home without constantly searching for the nearest restroom. Maintaining prostate health supports every one of those experiences. Throughout this video, we're going to explore practical habits that are supported by medical research and can easily fit into everyday life. None of them require perfection. None of them demand dramatic lifestyle changes overnight. Instead, they focus on steady improvements that become easier the longer you practice them. Sometimes the smallest daily decisions create the biggest long-term benefits. And the first habit we're about to discuss may seem surprisingly simple, yet it influences nearly every aspect of urinary health. It begins with something every man does every day, but very few think about strategically. The way you drink water. Sometimes the simplest habits are also the easiest to overlook. Most people assume that staying hydrated means drinking as much water as possible whenever they remember. While water is certainly essential, the timing of when you drink it can be just as important as the amount. This becomes especially true after the age of 60, when the body's natural thirst signals become less reliable and changes in the urinary system make the bladder more sensitive than it once was. Think about your own routine for a moment. Do you often get busy during the morning, realize late in the afternoon that you've hardly had anything to drink, and then try to make up for it by consuming several large glasses of water during the evening? If so, you're certainly not alone. Many men follow this exact pattern without realizing how much it can affect their sleep and urinary comfort. When your body goes for long periods without enough fluids, urine becomes more concentrated. Instead of being pale and diluted, it contains a higher concentration of waste products that can irritate the lining of the bladder. For someone whose prostate is already enlarged or whose urinary tract has become more sensitive with age, that irritation can make symptoms feel even worse. You may notice a stronger urge to urinate, more frequent bathroom visits, or increased discomfort that wasn't present before. Then comes the evening. After realizing you haven't had enough water during the day, it's tempting to drink several large glasses before bedtime. Unfortunately, your kidneys continue filtering those fluids while you're trying to sleep. Instead of enjoying several hours of uninterrupted rest, you may find yourself waking repeatedly throughout the night to empty your bladder. Poor sleep doesn't just leave you feeling tired the next morning. Night after night, interrupted sleep can influence your mood, concentration, energy levels, immune function, and even cardiovascular health. This is why smarter hydration isn't about drinking less water. It's about spreading your fluid intake throughout the hours when your body is naturally active. Starting your morning with a full glass of water helps replace fluids lost overnight and prepares your body for the day ahead. From there, drinking moderate amounts consistently throughout the morning and afternoon allows your kidneys to process fluids gradually instead of all at once. As evening approaches, many healthcare professionals recommend reducing unnecessary fluid intake during the final few hours before bedtime, unless your physician has advised otherwise, or you have medical conditions that require different hydration strategies. This simple adjustment often helps reduce nighttime bathroom trips without causing dehydration. Another important point involves what you're drinking. Water should remain your primary source of hydration whenever possible. Some beverages can irritate the bladder in certain individuals. Large amounts of caffeine, energy drinks, sugary beverages, and excessive alcohol may increase urinary urgency or frequency for some men. Not everyone responds the same way, but paying attention to how your body reacts can provide valuable clues. Keeping a simple journal for a week can sometimes reveal patterns you never noticed before. Write down approximately when you drink fluids, what beverages you choose, and how often you wake up during the night. Many patients are surprised to discover that small changes in timing lead to meaningful improvements within just a few days. Hydration also supports more than just the bladder. Adequate fluid intake helps circulation, assists the kidneys in removing waste products, supports healthy digestion, and contributes to overall body function. Every organ benefits when hydration is consistent rather than irregular. This is one reason why healthy habits often work together. Improving one area of your routine frequently creates positive effects in several others. Of course, hydration alone won't solve every prostate concern. If you're experiencing blood in the urine, severe pain, inability to urinate, unexplained weight loss, persistent burning during urination, or rapidly worsening symptoms, those situations require prompt medical evaluation rather than home management. Lifestyle habits are designed to support health, not replace professional medical care. Still, for many men with mild urinary symptoms associated with aging, improving hydration habits can become one of the easiest and most practical places to begin. There's another habit that works hand in hand with proper hydration. And unlike medication or expensive equipment, it requires nothing more than a comfortable pair of shoes and a willingness to move for a few minutes each day. We'll explore that next. Let's continue with the next habit, because if hydration lays the foundation for a healthier urinary system, movement is what helps keep that system functioning efficiently. The human body was never designed to remain seated for hours at a time. Yet for many men after retirement, daily movement gradually decreases. Whether it's spending more time watching television, driving, reading, or simply relaxing at home, long periods of sitting become common. While rest certainly has its place, too much inactivity can quietly affect circulation throughout the body, including the pelvic region, where the prostate, bladder, and surrounding muscles depend on a healthy blood supply. One of the most practical forms of exercise isn't intense training or spending hours in a gym. It's something nearly everyone can do, regardless of fitness level. A simple walk after a meal. Even 10 to 15 minutes of comfortable walking can encourage healthy blood flow, help regulate blood sugar, support digestion, and reduce the low-grade inflammation that often increases with age. These changes may seem small in the moment, but over months and years, they can contribute to better overall prostate health and improved urinary comfort. Think of your circulation as a delivery system. Every heartbeat sends oxygen, nutrients, hormones, and immune cells throughout your body. When circulation is working efficiently, tissues receive the resources they need to maintain themselves and recover from everyday wear. But when movement becomes limited day after day, blood flow can become less efficient, muscles weaken, and inflammation may become more difficult for the body to regulate. While walking isn't a cure for prostate enlargement, it supports many of the body's natural maintenance systems that help keep organs functioning as well as possible. After eating, your body begins digesting food and managing the rise in blood glucose that naturally follows a meal. Gentle movement helps muscles use glucose more efficiently, reducing unnecessary spikes in blood sugar. Better blood sugar control is beneficial not only for metabolic health, but also because long-term metabolic problems have been linked with greater inflammation and an increased likelihood of urinary symptoms in some men. In other words, that short walk after lunch or dinner benefits much more than your waistline. Many people assume exercise must be exhausting to produce results. Fortunately, that's not true. Consistency matters far more than intensity. A relaxed pace that slightly raises your breathing while still allowing comfortable conversation is often enough. You don't need expensive shoes, special equipment, or a gym membership. A walk around your neighborhood, through a local park, inside a shopping center, or even back and forth through your home during poor weather can all contribute to better health. I've spoken with many older adults who initially believed 10 minutes couldn't possibly make a difference. But after several weeks, they often described sleeping more comfortably, feeling more energetic during the day, and noticing gradual improvements in stiffness, digestion, and overall mobility. While everyone's experience is different, these positive changes remind us that the body responds remarkably well to regular movement, even when the exercise itself seems simple. Walking also provides benefits that extend beyond the physical. Stepping outside for a few minutes allows you to disconnect from daily stress, enjoy fresh air, and clear your mind. Chronic stress increases the production of hormones such as cortisol, and although stress alone doesn't cause prostate disease, it can make urinary urgency, muscle tension, and sleep problems feel more noticeable. Gentle physical activity acts as a natural stress reliever, helping both the body and mind settle into a healthier rhythm. If walking with a spouse, family member, neighbor, or friend is an option, the benefits may become even greater. Social interaction has been associated with better emotional health, improved motivation, and greater consistency when maintaining healthy routines. Instead of viewing your evening walk as another task on your schedule, think of it as an opportunity to reconnect with someone you care about, with your community, and with your own well-being. Of course, not everyone can walk comfortably. If arthritis, balance concerns, heart disease, or another medical condition limits mobility, there are still alternatives worth discussing with your healthcare provider. Chair exercises, water-based activities, gentle stretching, or supervised physical therapy programs can often provide meaningful movement while respecting individual limitations. The important message is not that everyone must walk the same distance or at the same speed. The goal is simply to avoid allowing prolonged inactivity to become your daily routine. Now, let's turn to another subject that many men hesitate to discuss, even though it plays an important role in prostate health. It's a topic that often carries unnecessary embarrassment, despite being a completely normal part of male biology. We're talking about sexual health. As men grow older, changes in hormone levels, circulation, medications, medical conditions, and emotional factors can all influence sexual function. Because of these changes, many men assume that intimacy is no longer important after a certain age. In reality, maintaining a healthy sexual life, when possible and appropriate for your circumstances, can be one aspect of supporting overall prostate function as well as emotional well-being. The prostate is responsible for producing much of the fluid that becomes part of semen. Like many organs in the body, it functions best when its normal physiological processes continue regularly. Research has explored whether regular ejaculation may be associated with a lower long-term risk of certain prostate conditions, although scientists continue to study exactly how these relationships work. While no single habit can eliminate the risk of prostate disease, maintaining healthy sexual function appears to be one component of a balanced lifestyle for many men. Beyond the prostate itself, intimacy offers benefits that reach far beyond physical health. Affection, emotional connection, and healthy relationships contribute to reduced stress, improved mood, and a greater sense of overall life satisfaction. These emotional factors influence sleep quality, cardiovascular health, immune function, and even motivation to maintain other healthy habits. It's also important to understand that experiencing changes in sexual function does not mean you should simply accept them without asking for help. Erectile dysfunction, reduced desire, or difficulty with sexual performance may sometimes reflect underlying conditions such as diabetes, high blood pressure, hormonal changes, medication side effects, or cardiovascular disease. Rather than viewing these symptoms as something to hide, consider them valuable signals that deserve an open conversation with your healthcare provider. Modern medicine offers many safe evaluation methods and treatment options, and in many cases, addressing the underlying cause improves not only sexual health, but overall health as well. The most important message is this: caring for your prostate is never about focusing on one single habit. It's about building a lifestyle where hydration, movement, emotional well-being, healthy relationships, and regular medical care work together to support your body as you age. And in the next section, we'll explore how the foods you choose every day can either support your prostate or gradually increase inflammation over time, often without you realizing it. Food has an incredible influence on the body, yet many people underestimate the impact that everyday meals have on long-term prostate health. We often think of food only in terms of calories or weight, but every meal also provides the building blocks your cells use to repair themselves, manage inflammation, support the immune system, and maintain healthy hormone balance. By the time a man reaches his 60s, these processes become even more important because the body's natural repair mechanisms are no longer as efficient as they were decades earlier. That doesn't mean healthy aging isn't possible. It simply means that your daily food choices begin to matter even more than they once did. Imagine your body as a home that has stood strong for many years. When the house is new, it can recover quickly from small problems. But as time passes, regular maintenance becomes essential. Replacing worn materials, fixing small cracks, and protecting the structure from damage prevents much larger problems in the future. Your prostate works in much the same way.